Dr. Greta here for hydration and how important it is, because everything works so much better if we're hydrated. And oftentimes we don't know we're dehydrated until it's way too late. So parents can watch a child, what they're taking in. And if they feel that the child is maybe getting a little ill or is overtired or gets overheated, then's the time to offer a lot more fluid and get that back in balance. So we're going to talk a little of what to do at each age. With the tiny little babies, oftentimes they will be breastfed or they will be bottle fed. And the bottle ones, you know how much they're supposed to take. The breast moms know that something isn't quite right, and they know that they need to push a little extra fluid as well. Some of the things you can do for a little baby is use a syringe. Just put it inside the cheek area and just push a little at a time, not enough to make them choke. Now this takes a long time. So suppose the baby is supposed to eat 6 ounces and has only had 3. That means that within the next hour or two, you want to get that 3 ounces in, but you're going to have to work at it pretty hard. The next thing that you can do is use a washcloth. Sometimes you get it wet and you put it on the lips, and they can absorb a lot of fluid off of their lips, and then ultimately maybe they'll put it on their tongue, and sometimes they'll, and that's what you want to do. That's another way of getting some fluid in. The next thing you can do for babies that are a little older, sometimes at least up to a year or so, is to use ice chips. Just put a little bit on, and then as they get older, they can do ice chips as well. If they have a fever, the ice may feel good, and usually it needs to be kind of a crushed thing. As they get a little older yet, a baby, sometimes babies, at least infant to closer to a year and older, can do a straw. And the sooner you can teach them how to do a straw, the better off you are, just giving them another option. Of course, we certainly want to always offer them whatever they are drinking otherwise, whether it's this or whether it's a cup as they get older. But if they won't take those, that's when you use some of these other things. Another thing as they get a little older is the popsicle. And I have some people that will just take water, and this has just got food coloring in it, just straight water with food coloring, and put just keep it in the freezer. In that way, then if you notice they're not drinking very well, you just automatically get that out and see if you can get them over the hump. Oftentimes, if we can just drink right away, we won't get as sick. Whereas if we get a little dehydrated, then we won't drink anything, and it's a real problem. As we get older, sometimes children enjoy a squirt bottle. The advantage of this is that children that are 4, 5, 6 years of age and even older can just sit and watch TV or do something and just squirt and get a whole lot of fluid in, whereas otherwise they're just not going to drink. So the important thing is to realize that hydration is important, and I think starting when they are even 2 months of age with giving them a little bit of water so they get used to what water is key. And don't put any sugar in it, but we want kids to like water. We'll hear a lot of adults say, oh, well, I don't like water. Well, that's not healthy, and it's not going to help them later on for just even daily life, let alone to be sick. So just remember, you ought to drink your water and give that kid a hug.